Hello, everybody. I am Dr. Dan Cordelicchio. I want to welcome you to the Healthy Destinations podcast, where we motivate, where we educate, where we inspire. And we have a very special guest. We have something different today. We have Lisa Marie, who is a licensed professional counselor, and we're going to have a great conversation today. Lisa Marie, thank you very much for coming on. Looking forward to our conversation. How are you today?
I'm great. I am doing really great. I've been looking forward to this since we scheduled it a couple of months ago. So thank you so much. I really appreciate it. Any opportunity to try and educate people about how to take better care of themselves, I'm all over it. So this is great.
Yeah.
Thank you so much.
Yeah, I think that's a great way to put that. That's why we say we motivate, we educate, we inspire, because we want to touch lives in a very positive way. So let me go over your bio. Lisa Marie is a licensed professional counselor and midlife transitions coach. I want to know what that is. I'm beyond midlife, I think, with over 15 years of experience providing psychotherapy and other mental health services to teens and adults in private, clinical, and educational settings. Lisa Marie integrates evidence-based therapies with holistic practices, which I think is great, to help out clients heal emotional pain and improve their health. Passionate about utilizing mind-body therapies, very important to help women in life embrace authenticity, find their purpose, and feel fit, fierce, I love that, and free. Yes, fierce and free. Master in counseling, licensed in New Jersey, certified clinical trauma professional. Reiki. So you're doing Reiki also. That's great.
Yeah.
Mindfulness-based stress reduction, dialectical behavioral therapy, say that 10 times, and commitment therapy, cognitive behavioral therapy, and positive psychology, University of, where is it? It's at a U of P, right? Angela Duckworth and her cohorts, right? Marty Seligman, I do believe, started the positive psychology, right?
Yes.
University of Penn. So welcome. Thank you very much. We'll be talking about body image and eating disorders in midlife. How did you get interested in this?
Well, it's kind of, I would have to separate midlife and body image eating disorders first off.
Go for it.
Yeah, really the interest in working with individuals in midlife and beyond really came to me just in the last couple of years. But the eating disorder and body image has been a passion of mine really since I started graduate school. Mm-hmm. The very first client I ever had was in recovery from an eating disorder. She had recently been discharged from an inpatient treatment center. I worked with her for maybe 14 months. So mm-hmm. This is a long relationship, and I learned so much from that experience. I feel, it challenged me in many different ways. And I feel like I probably gained more from the experience than she did, perhaps. Simply because I was, fresh out of graduate school. I had done my internships, and eating disorders are very complex. I would say that they, I don't typically at this point in private practice work with those who are, actively in treatment or struggling, with their health. But I tend to work more with individuals who are either, have their eating disorder reemerging in midlife, mm-hmm. Or it's something new for them. So, my work is a bit different now, but, they're very complex, lots of layers. I always felt, because I have advanced training working with addicts, that my eating disorder clients were much more challenging to work with than even those suffering from drug and alcohol addiction. Mm-hmm. So very complicated stuff.
Yeah, eating disorders, from what I remember, it's something that is very prevalent in our society, and something that has long-lasting both psychological and physical effects. So let's talk about some of the myths of of eating disorders, and let's get into the facts. So what are some of the myths that we can discuss?
Probably the biggest myth for, your audience, my audience, to walk away from is that eating disorders don't discriminate. If you're looking, and doctors unfortunately are not looking, but if you look at those individuals who experience these health challenges, you will see it across the board, all ages, all races, men and boys too, which people don't realize. It really does afflict a wide variety of people. So the myth that people have, when you say eating disorders, the image that pops into your mind typically is the upper middle class, white, young adolescent, right? But what we are seeing now, and really within the last 5-8 years, is an uptick in individuals over 40 checking into eating disorder treatment centers. So that population is very vulnerable, and those rates are on the rise. So I think now more than ever, we need to start opening up opportunities for individuals to have conversations about what's going on.
Right. And I think that's very important, because what you said also is important, where in my clinical practice, I'm trying to be better at making that referral with somebody who has an eating disorder. And as a clinical nutritionist, I can get somebody in, and then sometimes they open up to me, and I don't have the knowledge, skill, education, training, and experience, for that. And that is very important. And after this is over, we're going to talk, some business cards, because that's outside of my realm. And a lot of individuals come in, I think they have eating disorders, but I don't know. So what are some of give me some more myths, some more myths and some facts about these eating disorders.
The other one I would say that's pretty prevalent is that the image in the mind of someone who suffers from an eating disorder is emaciated, pencil thin.
Right.
But actually, anorexia, which, oftentimes a person is under body weight when they're experiencing anorexia, is actually a smaller percentage of the eating disorders that we typically see.
Right.
Bulimia and binge eating disorder numbers are much higher. And individuals who have those eating disorders, typically, I would say for bulimia, not binge eating disorder, because those who suffer from binge eating disorder can sometimes be overweight. But bulimia really is this large number of, individuals who can really fly under the radar, because their body weight for the most part is right within the normal range. So that's one of the other myths, is that this person can't possibly have an eating disorder because they look quote unquote quote normal, or
they look okay,
overweight, right?
Right. They look okay. So it's not something where, they do look emaciated. And let's go to the other extreme. Can you have an eating disorder? You're just eating too much, and now you have the obesity and you have overweight, which, it's a pandemic right now across the world, because even, patients that are coming in that are into my office that are 8, 9, 10, 11, 12 years old, they could be morbidly obese at that particular age. It's sad. So can we have somebody who's on the opposite end of the spectrum, where they're just eating too much?
Oh yeah, absolutely. I mean, I would say that most people that I talk with, they probably wouldn't meet the clinical criteria for having an eating disorder, but disordered eating patterns, absolutely. And one of them, of course, is overeating. It basically all comes down to an inability for people to self-regulate, to understand what's happening within their bodies, what emotions are arising, and not wanting to feel them. So one of the ways that people will, tune out is through food. It's easily accessible, right? It's necessary, which is one of the reasons why eating disorders are insidious, because you can't avoid food. You have to eat. It's unlike drugs or alcohol. So, that's the other myth, is that, it's easier, some may think, than
Right.
drugs or alcohol. No, it's actually more difficult for people to get a handle on their illness. So no, we definitely see more of individuals who have these disordered eating patterns, these faulty belief systems, and really
What are
it
some of
comes
those
down
faulty
to,
belief systems that lead to an eating disorder?
oh my gosh, there's so many, but at the heart of really all of it, I would say are kind of two things: an inability to regulate emotions
Hmm.
and shame.
Right.
So how that, notion of self, of not being worthy, not being good enough, wanting to please, how that develops. Of course, with my trauma background, I'm going to, focus on an individual's, early childhood experiences that
Hmm.
may have, formulated that concept of self and, feeling this big.
And do you find that a lot of those eating disorders do start in childhood, and by the time that we're in midlife and they haven't taken care of it, is it exacerbated that much more?
Could answer that almost like in two ways. So I would say that a lot of the people that I encounter now are those who are relapsing.
Hmm.
They had an eating disorder, whether they received formal treatment for it or not, it was identified. Even if it wasn't identified by, their family physician, it was known. And they went a period of time in their lives where they were not actively engaged in those behaviors that they used to help themselves cope as a young person.
Hmm.
And now, because of midlife stressors, there's an uptick. Now, some
Right.
people, they've struggled throughout their lifetime and it's gone under the radar, and they, for one reason or another, they've never told their doctor, they've never looked for treatment. So I think it's wonderful that people are actually confiding some of their personal struggles with you. And
Hmm.
then the other category that I don't see as much are the people who are experiencing an eating disorder for the first time in midlife.
What's the percentage of those, from your clinical experience, that are experiencing this eating disorder for the first time in midlife? Because I find that interesting that it's then that they're starting.
I haven't collected data, and this is one of my pet peeves with, the medical community. Unfortunately, we don't have the research, we don't have the numbers, the documentation to really hone in on those numbers. But if I had to say, I would bet that if I had more conversations with people who supposedly were just experiencing some disordered eating patterns or eating disorders, I bet with some digging, there was probably some evidence earlier on. So I'm going to just guess, based on my own experience, that that number is much smaller than the individuals who have struggled over a lifetime,
Hmm.
and or those who had their eating disorder identified early in life, and now it's reemerging. Eating disorders go under the radar all the time. People
Hmm.
are not looking for them. Dentists, I believe, are trained to look for, that really those eroded teeth and the
Right.
sores in the mouth, whether or not, but there's a lot of discomfort. If you talk to people in the medical community, there's a lot of discomfort approaching people about their size, whether they're, overweight, or whether they're noticing things
Right.
in an eating disorder. They just don't address it.
I think that's an important point. And for somebody such as myself, being the clinical nutritionist, perhaps they feel somewhat comfortable with, because there are X amount of patients that do come in, Lisa, and what they'll say is like, I'm overweight, I want to lose some weight, and then at some point in time during the consultation, they'll say to me, I had a bad childhood, or I had this, something happened that brought this about. And for me, like I said, I mean, that's so far outside of my thought process. I'm the blood guy. I'm like, all right, I want the food sensitivity test. I want the lipid panel. I want the diabetic panel. I want to know if there's leaky gut that's going on. and so forth. So I find this very interesting. So in midlife or even younger, who are the most vulnerable to get these eating disorders and this body image? Because I remember growing up in the 80s, especially during the 80s, the models were thin, very, very thin. You think of Kate Moss, very thin. And that's what everybody aspired to during that time. So what's the vulnerability in this?
For those in midlife or just in general?
In midlife, sure. Well, you know what? Those that have it, who've had the eating disorders for a period of time, as well as those that have it in life. What are the vulnerabilities?
I think the vulnerabilities really stem not so much from, there certainly is vulnerability to, our obsession in our culture with being thin. And, even in the medical community, there seems to be or not so, I'll get back to the medical community. Let's just stick with culture in general. We tend to measure someone's health by their size.
Right.
I've known plenty of thin people who are terribly unwell, and vice versa. So I feel like that's a big problem in our society, is that we equate a very slender person with being of good health, mind and body, and that's definitely not the case. In all cases, of course. But there's this thing going on in the medical community and just with people in general, where we inadvertently are perpetuating, this cycle with individuals, by saying things like, "You look great," when somebody has lost weight, and not really inquiring, well, what did they do to lose weight? What was the motivation?
Right.
Just as a quick story, I was diagnosed earlier this year with an autoimmune disorder. And prior to that, I was losing some weight. I was exercising regularly, and I've always been pretty good about what I eat. But I was getting a bit thin, and people who were close to me were making remarks like, I don't know what you're doing, but you need to slow down. And I was like, I have noticed that my clothes are, exceptionally loose. Well, when I went to the doctor to inquire about, my hand was bothering me, I thought it was maybe carpal tunnel. The first thing that the doctor said to me was, "Boy, you look good." Now, people who know me, people who care about me, they were telling me, "Lisa, you're too thin." And it was true. I mean, I'm short, so, but I definitely was too thin even for my height. And here we are. I walk into the doctor's office, and the first thing he remarks is, "Boy, you look good." So instead of like, "Hey, I've noticed that you've lost weight. Is everything? How you doing? Checking in with me about my diet and exercise regimen or anything, or even trying to connect it to maybe this." What was then discovered through blood work and, an autoimmune disease, there was none of that, so, we're seeing this all the time.
Right. In society, if you've lost the weight, and if there's that perception of you looking good, it sounds like what you're saying to me is, tell me why you lost the weight. Is it, did you diet? Did you exercise? Did you have an autoimmune condition? Very interesting that you mentioned an autoimmune condition, because I was diagnosed about 6 months with an autoimmune condition, and I had to lose some weight and leaky gut and so forth and so on. And my primary care thought that I had a terrible, horrible disease, and it found, it wasn't. I have thrombocytopenia. So they thought that I had like 6 months to live, and it wasn't that way. So, losing weight is good, but you have to do it for the right reasons, and you have to do it the right way, because the distinction is, being that supermodel, okay, and having that really, really thin body may not be healthy. And I think you're right. I know you're right, because I've had patients come into my office where they're thin, if you will, and then we do some blood work, and you're like, oh my goodness, it's like their cholesterol is off and their triglycerides are off, and you would never think that that would be the case. And then you have who would be categorized as having a high BMI, being overweight, and you do the blood work and everything comes back within normal. So do you lose weight at that point? You're healthy. Chemically, biochemically, and physiologically, you're healthy. And it's an interesting kind of fine line between the both. What are some of the health consequences that you see from an emotional, psychological standpoint? We'll go first with this disorders and this body image.
I mean, the physical health consequences are numerous. We could talk all day about that. And in large part, it has to do with what the eating disorder is. The health consequences for someone who is bulimic is different than someone who is anorexic. So some of it comes down to the types of behaviors that the individual is engaging in to help them cope and to help them manage. And that's going to affect, the types of consequences that they're going to experience. So, with bulimia, they're also purging. Those purging behaviors, they're eliminating some positive things from their gut as well. And they're losing those electrolytes, and that affects, the rhythm of your heart. And, so there's all of that. And then you have the, anorexia with the malnutrition and the bone density issues, down the road. And binge eating disorder, certainly you're putting yourself at an increased risk for the diabetes, and there's ruptured stomach, and there's all sorts of things. So, but the psychological piece, yes, that's the part that concerns me the most, because if we are going to make real sustainable changes, whether it's to lose a healthy amount of weight, whether it's to put on weight, or just be able to regulate emotions in a healthy way, we have to do some work on what's going on between the ears, right? And that's often a little more difficult. There's this huge gray area. You really have to stick with it. You're not going to have those markers like you would on a scale. Okay, I've lost 5 pounds. That gives me the encouragement and motivation to keep going. Doing that inner work, digging deep and trying to discern, like, how did I develop these patterns of belief, these belief systems about myself and about the world. And, that takes a lot of courage. I always say I admire anyone who takes that step, and wants to do some inner work and some self-discovery, because it's not an easy thing to do.
Right. And what are some of the health, the psychological health consequences? Do you find that, and I don't know if I want to use this word, do you find out that they have phobias about food? They just have a bad relationship with food. What are some of the diagnoses, or what's some of the conditions that come out of eating disorders from a psychological?
I mean, typically the comorbidity rates with eating disorders and substance use or alcoholism. But, in terms of, a specific mental health disorder diagnosis, we see a lot of depression, and with depression, you're going to have anxiety. So they may have a dual diagnosis of both depression and anxiety. But I would say overall, if we were looking at like a general umbrella, I would pinpoint depression, without a doubt. And, the eating disorder cycle is, it's like chicken or the egg, what came first. And, like abusing substances, you alter your brain chemistry, and your brain starts to, rewire itself to learn how to cope in a particular way. And so to undo that carefully and mindfully and respectfully, quite honestly, is something that, a person really does need to work with a professional to help them gain some better control. Otherwise, the pattern will just continue to repeat itself, and with that, you talk about the psychological impact, it's going to impair their relationship with themselves, with, their significant other. Anything I think that occupies too much of our headspace is not healthy. And so if you are obsessing and ruminating on your appearance and the scale and food and measuring all day long, that's just breeding more anxiety, right? It's just breeding more attention to a matter that ultimately is going to make you feel worse, and it's that shame and guilt that these individuals experience that then just fuels the eating disorder. So I would say that those are probably the most prevalent psychological issues associated with these health issues.
I find what you said fascinating, and you used the word obsessive. And I find it fascinating because we're talking about midlife, and males and females are both in this category from what I see, where they do want to look good because of that body image, and they obsess over it. And there's actually some studies where, it's like, are you eating too well to lose the weight? And that could be a psychological condition also. Have you come across that?
Oh, all the time. So that's actually really common. It's like, especially for those who have developed an eating disorder, in their 20s, 30s, or later in life, they start with good intentions. Mm-hmm. There's a real need to, eat differently or lose some weight. And it might start out as very appropriate and within the guidelines of their physician, their nutritionist, and it just runs amok, it runs awry. And usually what I see with that is there was probably an underlying vulnerability to depression or anxiety, mm-hmm. or maybe there was a diagnosis that was not treated properly. Mm-hmm. And so then the eating disorder just becomes like the outlet for those mental health conditions. Especially if you think about it, when your behaviors are being reinforced by society. You look good, keep it up, keep going. Oh, if you have low self-esteem, well, that makes you feel good. Right. You feel accepted. You feel like, you're holding your head a little higher. Well, what happens if I restrict a little more? What happens if I give up this, food category? What if I just add an extra few miles to my run? So the person who is vulnerable to those, depressive disorders or anxiety disorders, they almost take it too far, and now it becomes problematic in a new way.
Right. Because I noticed in my own practice, January and February, there's always that uptick. Beginning of March, there's always the uptick and you know exactly what I'm going to say. There's always that uptick in patients coming in because, beach weather's coming up and they want to look good on the beach.
Yes.
They want to look good on the beach. And, for some individuals, not all, and maybe you can speak about this, I find that if you're in your 50s, you're male or female, sometimes you want to keep up with your son and or daughter that's in their early 20s. And, their friends are over and you want to look equally as good as your son or daughter does. Do you find that in your practice also?
I do. And not just professionally, just, personally as well, right. Talking with individuals that, and maybe it has to do with, we're always younger in our minds, right? You ever look in the mirror and you're like, who is that person? So I don't know if some of that has to do with it, but why is the individual comparing themselves to someone in their 20s and 30s anyway? Why are they comparing themselves to how they looked in their 20s or 30s? And this is where the acceptance piece comes in. You're not in your 20s or 30s. You're in your 40s, 50s, 60s, right? And beyond. And so what is the best you can look, the healthiest you can be for your body at this stage in your life? That's a much healthier mindset than, oh, I want to be over there. I want to look like that. I want to, feel that way. That's not you. So you're setting yourself up for some unrealistic expectations, self-sabotage, all of that.
And then you start failing.
Reinforce it.
Right. And then it becomes perpetual and then you start failing because there's no way that you're going to reach your goal. at all. And I find that I'm seeing more and more of this in my office where they want to look like their sons or their daughters. And I'm like, I say to myself, well, as a doc, I have to take you on, but that may not be the best way in order to do this. So, it's different if you come in with a condition. I have a 12-year-old, and I'm 58 years old, and he's very active. He plays hockey at a very high level, and I like to work out with him. And I like to work out with him not because I'm going to physically look good, but you know what? I want to impart life lessons to him. I don't know if that makes sense. It's like you're working out, you're sticking to it. Dad, I have a lot of pressure on me. We got a big game this weekend. Dad understands. He played sports. He played football. He did this. And I want to be able to be there with him to help him. So that's kind of a why for me. The side effect may be getting a 2-pack or a 3-pack, but that's not the main goal. I want to keep up with him. So when he's running and he has something that, he's talking to me about, I want to be able to discuss it with him, and plus I was diagnosed with this thrombocytopenia. It's related to my leaky gut, and my primary care, who's my partner, she thought I had leukemia. So I had to lose weight. So at that point in time, all bets are off. I'm losing weight and I'm going on a leaky gut protocol. So talk to me about some challenges that you have in treating eating disorders. Do individuals resist a lot when you're treating them? Do they have a tough time changing eating patterns?
Oh, yes.
Image. Ooh, I like that one myself.
You do. Yeah. When I had an office, a private practice before my children were born. And at that time, I was really connected with a couple of different eating disorder treatment centers. So a lot of the clients who were discharged, the relationship I had with the center, they were referred to me for ongoing, care and support. And more so than any other population, I would have cancellations. They would start treatment, they would, back out, then they'd call me a few months later. Very high ambivalence. And, again, that really just speaks to the shame around these issues. And I see that a lot with older women because, again, that myth of this is only supposed to afflict the young, and so, why am I obsessing on my appearance? Why am I, coping with food? Or they may not even recognize that that's what they're doing. But, if they do have a hint of it, they kind of skirt away from that thought and that feeling because there's so much shame around it because they think that, oh, I should be past that. I'm too old for that. I should know better. All those shoulds start popping up. So, that's a real concern is that, people in that category, they feel the stigma of mental health in general, and they are unwilling or just super scared, about what it might mean, to have an issue around food and around their appearance.
Right. And do you find, and this is probably a hot button topic, but do you find, I come from an Italian-American family and, immigrant family, and eating was always, big. And I remember, even playing, football, you had the physique going on because you were working out. You were working out with weights. You were getting stronger, And I remember my grandmother always said to me, I looked anemic, and she wanted to fatten me up. And she just would put bowl after bowl of macaroni and meatballs and brunch, all of that. And do you find that you have a lot of cultural issues when you're dealing with people with this body image?
Yes, cultural for sure, and generational.
Right.
we still hear, right, when the mom has her baby, and oh, it's a big chubby baby. We love those big babies, right?
We love those big
And
chubby
like,
cheeks, right?
what's that?
We love the big chubby cheeks.
Yeah, the big cheeks. Yeah.
That's what they say.
But maybe that's not so healthy. Maybe that child is actually out of their their percentile, and they're being overfed. Who knows? But so there is this mindset that especially for young kids, that it's acceptable. It's for babies. It's cute. It's that's simply not so. So I would say generational too, and that maybe an older generation might view weight differently, and that you should have that cake. It's a celebration. They almost get insulted if a person is mindful about what they eat. Or I know, as vegetarian for many years and vegan, the scrutiny at celebrations or holidays. Well, what is wrong with you? And what do you eat? And all kinds of mixed messages, around food. Yeah.
Yeah, you get you're crazy, what are you doing, and so forth. That word crazy, and I've heard that word crazy in my own life, because when I was 37 years old, I had a heart attack, and I ballooned up to 250 pounds. I had offices in 3 different states, and it was when I first graduated chiropractic school, and so they were busy, and your food intake and your caloric intake was not really good. You came out of the office and there was a particular fast food restaurant, and you were going from one office to the next office, and you had gained weight, and then Sunday dinner was always macaroni, and there was always a meatballs and sausage, and everybody was happy that I was at 250 pounds except for one person. So I remember in the office one day, I was feeling not so well, and a week later, I was in the hospital ER in Perth Amboy, and my blood pressure was 220 over, I can't remember what it was. Eventually, my triglycerides were 1,227, which the cardiologist said to me that you're one of the ones that are very lucky, because really, it's fatal at that point. So the point of all of this is that I'm eating poorly, and even at home, I'm eating a lot, because, it was, one of the greatest pleasures was homemade manigot that my grandmother made. And so when I said I couldn't eat that anymore, the look on their faces, and I remember my grandmother and I remember my mother. Okay, here, my grandmother used to call me grandma. Okay, grandma, here, have a bowl of macaroni, you'll feel better. No, you're not listening to me, right? So you get that stigma that you're doing something so different from what the culture, what the generations are doing. So that leads me into my next question. With your clients, how do you cultivate, purpose, meaning, positivity to make these changes when you have society that's out there, and you have family members especially, right? Because they're the number one culprits that are saying, no, you can't eat that way, right?
Push those buttons, yeah.
Yeah. How do you change that? How do you cultivate that? That's tough, right?
Well, yeah, it is. But at least at this stage, in my work, the individuals who are contacting me, some of that ambivalence has diminished. And, 2 of the biggest words that I hear a lot are stuck, that they're stuck and lost. I'm lost. They kind of have forgotten who they are. And, they're ready to regain some of that, or take a look at that. So I don't see as much of that presently, but something you said just a few moments ago, I think answers your question. And that is, you said, I was the one person who was not happy. And everybody deserves happiness, right? And I think that if I can help them make that connection, that they are as valuable and as important as, their significant other, their parent, their child, and that their happiness ultimately is going to improve their relationship.
Mm-hmm.
It might change the dynamics a bit because people may not like the changes that they're making initially. They're kind of messing around with the equilibrium in their family, but ultimately though, you have to come home to yourself, right? You have to be able to lie your head down at night knowing that you've done the best that you can. And if you are not at peace with what's going on inside of you, it's going to leak out and infect everything around you eventually. So, the notion of, I need to keep the peace, or, this one's going to be upset with me and it's going to be devastating to the family. No, it's not, and, what sort of things are presently happening that are devastating, so a lot of times it's just working with the anxiety and the uncertainty, and coming to some acceptance around what can be changed and what cannot. The idea of changing other people, or I just want mom or dad, or, son, daughter, husband, wife to get it, forget it.
Right.
They don't have to get it in order for you to change. They don't have to like it. They don't have to get it in order for you to be the highest version of yourself.
Right.
Either they're going to get on board and come around and respond in a healthful, appropriate way, or they're not. But, for the most part, people do. It's just that any change is tough,
It is. And I think that's the important, word, is that when you're making changes, and, I make the physical lifestyle changes, you're making the mental, emotional, psychological lifestyle changes. And, you have to do it for yourself. I mean, from what you said, I remember, my father passed when he was 71 years old, about 10 years ago, and growing up in a more immigrant family than what I did. My father, putting food on the table, you ate to excess because you didn't have that coming over from where they came over in southern Italy. So you had a lot of bread. You filled up on stuff that wasn't good for you. So I wanted to change my father, by eating better, because of course you want your father, you want your mother, you want your parents to be around longer. And I saw the decline in him, in his health, and if I were to show you a picture, it's right over my right shoulder. My father's 58 years old, and the way I look, it's two totally different generations. And you have to do it for yourself. You're, like you said, I wasn't the one that was happy. And to this day, nobody in my family followed me. So I had to do it on my own, so my mother, my father, my sisters, when we see each other, they just kind of laugh at me. What are you doing? What are you eating now? Right. So you being a vegan, you get that, right? So I'm having a piece of salmon, like, what are you eating that fish for? Mom has a nice prosciutto sandwich ready to go for you. And she's got nice, fresh mozzarella. And I'm salivating. It's having a Pavlovian reaction because that's what I was accustomed to eating. However, I will admit, one time a year, either Christmas or Thanksgiving, during the holidays, I don't eat the turkey. I don't eat the ham. My mother knows enough to make a baker's dozen, 13 homemade Montagort for me. But this past
That's a lot of ricotta.
Oh man, that's good stuff though. But I had gained some weight, about 8 pounds, and it was very difficult. And this was just prior to the thrombocytopenia. So let's talk. You and I were talking about core beliefs. What are some of the core beliefs about beauty and self-worth that you impart upon a client of yours that's coming in and that wants to make this change?
Well, I just want to back up for one moment.
Of course.
Just related to your story, and just.
I think you're going to start psychoanalyzing me.
No. That's not.
That's
what
okay. That's all good.
I'm
That's all good. You can
an
do
example,
that.
to empathize with anyone, family, it can be a wonderful support system and our biggest cheerleaders, but, they're also, tied to some of those core beliefs, and they know how to push those buttons, and they probably aren't doing it with, any conscious awareness. It's just the dynamics of the relationship. But, there's a lot instilled in us from the time that we're young, that food is comfort, and that
Yes.
everything can be smoothed over with the sandwich and then, the meal and this and that. And it comes from a loving place, right? Like,
Right.
your parents want to, soothe you with a particular meal or do something nice for you. And, so that is hard for people to relegate sometimes, that they don't want to be insulting, but at the same time, they want to take good care of themselves. So having, clients develop an awareness around, some of what just goes on with families helps them to, rather than get angry at mom or dad or someone for, not doing the right thing, it helps them, if you can sort of see it from another perspective, have some compassion, have some understanding of where that person's coming from, so that they don't demonize anyone in their family, that they, can still have a relationship with them. It's just, setting new boundaries around the family members and the food is what, I try to help them with. So I just wanted to, acknowledge that is a real, that's a real hardship for people, is, accepting the comfort and then also not wanting to disappoint and all of that.
I totally agree, because I used to get very, very angry at my family, because after, especially the first health condition, it was a situation where there's always, you come from an Italian family, everybody's making fun of everybody, and after a while I was like, all right, guys, it's not funny that you put a meatball sandwich, in the refrigerator, so when I open it up to get my bottle of water, there it is, and it has my name on it, and at some point in time, I got really, really very angry. I told you, you're gonna analyze me today. So, I would get very angry at that, and I wanted to get back at them, like saying, hey, listen, look how I look and look how you look. There's a big difference, and then I would make them want to look like me. And it was the physical aspect. It was that body image, right? I wanted them, and, it was a passive aggressive type of a situation where I was kind of making fun of them and saying, hey, look the way I look, but you don't look so good. So, I kind of got back at them, because I was angry for what they were doing. All right. Do you have any comments on that?
Just that, I think that your experience though is actually kind of common. I mean, we attack people based on appearance, and yes, we do use our appearance as a weapon in some respects, right? For power and control and all of those things. So, elements of what you're describing is really not atypical, right? It's,
I feel better about myself that I did this.
There's this universal, piece that, look, it's a part of our culture. We all live in this society, and so we are all susceptible and vulnerable to a degree. And I think the only way to really combat that and make sure that we're making decisions and choices that are aligned with who we are and who we want to be is to have that awareness. So that's kind of a piece of any of the work that I do is, how aware are you of, those behaviors? Like, you're aware of that now, you're able to separate and see what was going on. And that's important for people to do, because if you're in the thick of it, it's hard to make those changes.
Right.
If you have some separation from it and you're able to see it with fresh eyes, then that makes the change a little bit more palatable in the long run.
Right. Interesting stuff. So let's get back into a little bit more about core beliefs. How do you change those core beliefs? I mean, you're watching TV, and you have the latest, perfume, and you see beautiful people, that are at a party, and they're, I got this perfume on, or I got this dress on, I got this brand new jacket that I'm wearing, and, I want to look good and so forth. So how do you change that?
I don't know that you, Well, first, there has to be some acknowledgement that these belief systems exist, and that some willingness or motivation to at least look at them and want to make certain changes. It's certainly, especially if I'm working with someone not in the coaching capacity but in the therapy capacity, you don't want to thrust somebody into a realm that they're not ready to go towards, right?
Mm-hmm.
So it depends on their willingness to take a look at what is going on. And sometimes the only motivation or the only thing that brings people to the table to look at those things are some consequences.
Mm-hmm.
Whether they've had some issues in their relationships or at work, or they're just not feeling very well. So helping them make the connection between where they're at, where they'd like to be, how they're feeling and how they'd like to feel, is oftentimes enough of a window of opportunity to have conversations about, what sort of thoughts are, accompanying those behaviors. I always like to work from the bottom up.
Mm-hmm.
So I always go to the body first. We do enough as a society, I think, of just intellectualizing and pathologizing our thoughts. And, certainly thoughts can lead to a sensation, and then we, freak out. So I always like to come back to, what's going on in the body. Before you did that behavior, or when you had that thought, can we bring it down to the body? What were the physical sensations that you were experiencing? And a lot of times that will elicit a conversation about the core beliefs as well. If they're getting a pit in their stomach every time they have, a conversation with their superior, their boss, well, what is that about? What sort of thoughts are associated with that pit in your stomach? And it might illuminate, a conversation about, maybe some similarities between their boss and a parent figure, or someone who made them feel small, or, and so that kind of opens up conversations about where those thoughts may have generated.
That's very interesting. And what I also find very interesting, you're using evidence-based therapies with holistic practices.
Mm-hmm.
Holistic practices that you're using in your in your office. I think the listeners are very interested in this.
I'm sorry, you said the listeners are
Our listeners would be very interested.
Yeah.
What are the holistic practices that you're using?
So one of the reasons why acceptance commitment therapy appeals to me so much and resonates with me both personally and professionally is it incorporates a lot of mindfulness. It incorporates a lot of mind-body connection. Mm-hmm. That you cannot be, well up here and not below, and vice versa. That you need to both listen to your body and, help your mind understand what is actually happening with your body, so that is this a situation that I really need to be concerned about and frightened, mm-hmm. or is this maybe this situation activating like a past event that's triggering for me? Help them really understand and discern what's happening, what feelings they're having, as opposed to tuning out. We're in a society and a time in our lives where we love to tune out, and we have a lot of different ways to tune out, much more so than you and I did when we were kids. Mm-hmm. And that's part of the challenge as well, is to help people kind of face what's going on within themselves and not be frightened of it, and actually use it as a tool. That's where the mindfulness comes in. So I would say that that's my primary means of working with individuals, is helping them learn more about mindfulness, giving them the tools and opportunities or encouragement to practice mindfulness. But as a Reiki practitioner, if that's something that they're interested in, we can, explore that possibility. Right. But I do a lot of referrals to individuals who, other professionals who are massage therapists. Mm-hmm. Some people are so detached from their bodies that, massage and the actual, manipulation with the muscles and all of that is really very healing for them. Mm-hmm. So, while I'm not a massage therapist, I certainly, make that recommendation to people. Right. Anything that helps individuals ground themselves and use their senses, so whether it's the essential oils, like we're talking about our mutual right. friend, and incorporating that into their lives. But, all those little pieces are really a nice complementary piece to the psychological work.
Right. Right. Now, I have a question about intuitive eating.
Mm-hmm.
Nutritionist, I've been practicing for 30 years. I've heard about this, and some nutritionists and some dietitians use it. Can you explain how you incorporate, what is intuitive eating, and how do you incorporate this into your practice?
So again, it all comes down to listening to the body. So when people are out of their body, when they are dysregulated, and they are using food, either consuming too much, too little, restricting, purging, whatever, they are using food to help themselves manage, they are not mindful about what they're eating, right? They are consuming compulsively, and they're not listening to their body's cues. So one of the things we do is help individuals learn what are the physical cues of hunger. Because a lot of people don't know what it is anymore. We eat at our desks, we eat in the car. I'm guilty of it too, don't get me wrong.
Right. We all do that. We all do that.
Yeah.
Yes.
I mean, like you said earlier too, like you're burning the candle at both ends. You're getting home from work late. You stuff whatever you can in your face. It's part of our culture also with the amount that we work and all of that. But we don't even know when we're hungry. A lot of times individuals are dehydrated. They need to consume more water. They're not actually hungry. So one of the first things is to just, how do I know when I'm hungry? We can give them, a time frame of when their body digests their food and their stomach empties and all of that. But I want them to really know the difference between an actual hunger cue and another feeling, like I'm lonely, I'm scared, I'm anxious, I'm worried, I'm stressed. That is not hunger, but a lot of people will then go to food to, help themselves. So that's one of the first things there, is to just start recognizing those physical cues of hunger.
Interesting. Now we're coming up on an hour. I have a couple of more questions. It goes very fast, Lisa. Right? You're sitting there. Next thing you know, you're an hour and a half. Excuse me, into the conversation. Tell me, what is the SE approach? What does that mean, and how do you apply it?
Well, I think when I had sent you information about the work that I do, SE is somatic experiencing, and that relates to studying trauma and how our nervous system really records those events, and then kind of shapes our view of ourselves and the world. Unless we are, in my practice now, I'm not doing as much digging and diving so deep, because the clients that I'm seeing are at a different stage, at least with regard to the disorder. But if we are working on trauma specifically, that's where that bottom-up processing also comes from, is somatic experiencing, is really helping individuals understand whatever sensations come up in their body and at any given moment, and to have a cognitive awareness then of what that sensation speaks to, what it actually means. And then it allows people to then have that separation, be able to make a choice about how they'd like to respond. So it really does also have elements of the mindfulness in there as well. Because when we are acting compulsively, when we are doing things on autopilot and we're not mindful, we just consume, we just do, we don't even know why we're doing it. So all of these different modalities really give individuals an opportunity to make choices, because how many times do we just do things without thinking them through, or and then afterwards we're like, so all of these modalities are really designed to kind of give you that pause, so you can think about, well, how do I want to respond in this situation, so.
Excellent information. So one more question, very open question. Is there anything that you want to discuss? Any clinical pearls, anything about body image, eating disorders that we haven't discussed that you want to, impart upon our listeners today?
Probably so much. But I think that the biggest thing is just this is more prevalent and more common than people realize. And I think that if our audience walks away understanding that, perhaps it will destigmatize, some of the feelings around it, and people will be more inclined to seek some help and support. There are numerous ways to try to help individuals. And, it doesn't come down to just, how I like to work with people. I would encourage them to explore all different options because everybody is different. But it is possible to change. I want people to walk away with that.
That's very important. Yes.
And living a healthful, meaningful, purposeful life is absolutely possible. You just need to give yourself some of the time that you probably give to your loved ones. You need to carve out that piece to, start taking better care of yourself. And it's okay if you need some help and support for that. We're not born knowing this stuff. In fact, what we're taught is a lot of times, not very helpful. So
great information, great final comment. And yet there's so much more to discuss. So what we'll do is in a couple of months, we'll have you back on. We'll discuss part 2. And we'll go from there. We'll discuss part 2. How can our listeners contact you?
Probably, the best way would be just through my website. It's lisamarie-coaching.com. Is probably the best way. They have an opportunity there to set up a discovery session with me. It's complimentary. And that really helps people. I mean, most people know when they contact me, whether they're reaching out for counseling or they're reaching out for coaching. But, the discovery session will help, answer their questions so we can determine, what's the best course of action here.
I love it. Excellent. And we'll make sure we put that into the podcast so that when they're listening, they can see where they can go get you on the on your website. Lisa, thank you very much.
No, thank you, Dan. I really appreciate it. Anytime you get the word out to help people, I am there.
Yeah, this is great. We, on our podcast, we talk a lot about the physical, and this was something that I don't want to use the word different, but it's just an approach from a different angle, and I love every moment of it. So, as I say, we always have the best of the best of the best on our podcast. Lisa is no exception. Give her a call, okay? Confidential. Give her a call. You can see the experience, the knowledge, the passion coming through. Thank you very much, Lisa.
Thank you.
We will take, into the next time, we'll see everybody. So take care, everybody. Thank you.
Perfect. Thank you so much. Take care. Bye-bye.